Hello, sir. My name is Amani Ariahu. I'm a nurse practitioner student. I see you here for an abdominal assessment today. Can I have your name and can I have your first and last name, sir? And can I have your date of birth as well? And the patient tells me his name and his birthday. Okay, so the assessment is just going to involve me just touching around your belly and just at some point probably applying some deep pressures in some aspects of your belly, and I'm also going to listen to just listen to your abdomen. Is that okay, sir? Okay, good. So I'm just going to start with my assessment. So my assessment usually involves just looking at the patient's skin, making sure patient's skin is even, make sure there's no jaundice. I'll look for lesions. I'll look for purpura. I'll check for stomas, surgical incisions. I'll look for if there's any hernias. Look for abdominal distension. The patient probably has maybe ascites. I'll also check the contour of the belly. So the patient's belly is flat, rounded, or protuberant. I'll look for pulsations in around the aortic area. I'll check for peristalsis. I'll also check for just maybe if the patient has maybe any dialysis catheters or anything. Check for scarring, moles, any lumps, bumps, in the patient's abdominal area. So this will be my inspection to check for any form of abnormalities on the patient's skin. Secondly, we auscultate. So they will just be listening to patients' bowel sounds in the four quadrants of the abdomen, which are the right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. So I'm going to listen with my stethoscope just to see if I can pick up any abnormal sounds. But what I should hear should be active, bowel sounds. If the bowel sounds are hypoactive or absent, I should be considering maybe paralytic ileus or maybe possibly peritonitis. Okay, so Mr. Teddy, I'm going to listen to your bowels, okay, with my stethoscope, just around your belly, okay? So I'm just going to listen to 5 to 10 seconds on each quadrant. And so after this, I'm just gonna just auscultate for bruits in the aortic area, in the aorta, the kidney arteries, iliac arteries, and the femoral arteries. Okay. So this, and I'll be listening with my bell. So this is for the aorta. I'm just gonna check for the kidneys, left and right. Yeah, the iliac arteries, right side and left side. And I'm gonna go to the femoral, just around the groin area. All right, left and right. Okay, so they're all like +2. I don't see any any bruits or anything. We're good there. Okay, so next I'm gonna precuss patients patient's abdomen. So usually the belly is divided into 9 different regions. So I'd say we divide it like in like 3 different quadrants. Okay. So do it this way and this way, just illustrating. So we have the iliac region. We have the right iliac region. We have the right flank. We also have the right hypochondria. And going on here, we have the hypogastric area. We have the umbilical area where we have the belly button. We also have the epigastric area. And then on the left side, we have the left iliac area. We have the left flank area, and then the left hypochondria. Okay, so I'm just gonna precuss, in this different area. That will be using my fingers and doing a tapping sound just to check for differences in resonance, tympani, and dull sounds in the abdomen. Okay, I'm just gonna go through the different areas. Okay, so what I hear, just the tympani, the abdominal area, and then the lung area, just the resonance. I don't really, some of the dull areas are where we have like masses, and we have the organs, the liver, the gallbladder, if there's stool in the descending colon and stuff, and then maybe there's a lot of urine in the bladder, so you can access that dull sound usually from liquids and from solid masses, or even neoplasm around the abdominal portion of the abdomen could give you that dullness sound. Okay, so after precaution, I'm just gonna palpate the patient's abdomen lightly and then deeply. So while I'm palpating, I'm just gonna take a look at my patient, and inform them. Just let them know, to inform me just in case they feel any form of pain. I would also be looking at my patient's facial expressions, just to see if the patient's having any pain. And again, if a patient actually indicates pain in a certain area, I'm just gonna start palpating away, from that area. Even precaution too. Percussion, I would also palpate away from the area of pain. Okay, so my patient in this instance doesn't state any pain, so I'm just gonna start just palpating around. Okay, just gently, just light palpations, just like in a circle, circular. Okay, all right. While I'm taking a look at my patient and just seeing if patient is not having any pain or maybe grimacing or anything, and then I'm gonna go ahead and I'm gonna do deeper palpation. So I'm gonna tell my patient, Mr. Teddy, I'm gonna be palpating, but it's gonna feel a little deeper. Okay, if you feel any pain or discomfort, you should let me know. Okay, all right. Same way in a circular motion. Palpate deep. Okay, and my patient seems comfortable. If any form of discomfort in any region, then I would be a little bit worried. Okay, so after that, we're going to be testing for assessing for peritoneal inflammation. Okay, so first of all, I'm going to be testing for rebound tenderness. And sometimes it also is a test for, if there's any inflammation in the peritoneal area. So this just involves me deeply pressing palpating into the abdomen and then quickly releasing. So once that is done, and then once I palpate deeply and release, and the patient feels pain or have some kind of pain in the process of quick release, the patient has a positive Murphy sign, and which would positive rebound tenderness, which could indicate something etiological or something going on in there. Okay, so Mr. Teddy, I'm just gonna palpate deeply into your belly, just same thing like we did, but I'm just gonna do it real quick. Okay, so I'm just gonna palpate in real deep and then release, and take a look at my patient, how my patient reacts, if it's painful or he feels any form of pain or discomfort in that area. Okay, and then next is gonna be the Murphy sign, and the Murphy sign is also an indication of appendicite. Sorry, it's an indication of an inflammation of the gallbladder or the liver. So in this case, I'm just gonna try to palpate towards the mid-clavicular area, because the liver and the gallbladder are in the same location, so they're pretty much underneath the rib cage. So I'm going to be palpating from the iliac area just right up to the right upper quadrant, and then underneath the rib cage, just to feel deeply to see if there's any pain. Okay. And when I'm approaching, I'll ask my patient to take a deep breath and push dip. And then once my patient takes a deep breath in, the liver or the gallbladder descends. And once the patient feels pain on inspiration or pauses or halts in the process, patient could have a positive morphe, sign. And so in this case, my patient is comfortable. But if he had pain while inspiration or while palpating, and as the gallbladder liver descended, the patient will be having a positive morphe sign. Okay, and then secondly, we're going to do the Roving sign. The Roving sign is also a test, for peritoneal inflammation, mostly for appendicitis. So this actually involves deeply pressing into the patient's left lower quadrant and quickly releasing. And if the patient feels pain on the right lower quadrant, then it is a positive Roving sign. So, and in this case, my patient doesn't have any pain. But if the patient had any pain after my quick release on the right lower quadrant area, we could be considering positive Roving sign. Okay, and then next we're going to be doing the obturator sign. So the obturator sign just involves placing the patient's leg, hip and knee, flexing it, and then internally rotating. So this kind of like this actually kind of like flexes the it actually like kind of stretches the muscle of the obturator muscle, and that kind of like triggers the pain in the left lower quadrant if the patient has appendicitis. So once I do that and the patient feels pain, yeah, that could be considered a positive obturator sign, and because the muscle could trigger the inflammation on the appendix itself. Okay, so then we're going to do the soul sign. The soul sign, this involves lying the patient on his left side, right, and then having flex the patient's flexing the patient's left side just backwards. Okay, and then if the patient feels pain in the left right lower quadrant, it could be a sign of appendicitis, because stretching the muscle of the stretching the internal psoas muscle could trigger the inflammation on the appendix, causing pain to the patient. So if this happened and patient complains of pain, we could consider a positive soul sign and a positivity and high chances of patient having appendicitis. Okay, so and then for the last assessment for peritoneal inflammation, it would be the cutaneous hyperesthesia. This is just a sensation that is derived from the T10 to L1 nerve roots. It's also an indication of appendicitis. This just involves just lightly touching patients with a stethoscope just around the right lower quadrant area, and then the patient feels some kind of like very uncomfortable, sensation. So we could be, considering considering a positive cutaneous hyperesthesia in this case. Okay, so we're done with all that. So we're gonna go back to percussing the liver, the spleen, also palpating both of them, and also palpating the kidneys. Okay. So when percussing the liver, usually we start palpating from the left. We start palpating, from the right iliac crest through the midline, just upwards to the right to the right upper quadrant of the abdomen. Okay, so and that just because the liver could extend all the way down if there's if there's hypomegaly, hypomegaly liver extension. Okay, so we're just gonna go ahead and start precursing. So I'm just gonna precurse from the third intercostal space, till I sense dullness, and I'm also gonna precurse all the way down from the iliac region all the way up, just to check from resonance or tympanic sounds to dullness, so, and then I'm able to, find out what the liver span is. And usually for healthy individuals, it's usually between 6 centimeters to 12. Okay, so I'm just gonna start precursing. Usually from the third intercostal space. Okay, I'm gonna mark that, and then I'm gonna go from below to the top. Okay, so this is where I feel the dullness, and there's the dullness in here. So I'm just gonna measure the distance between both sides. So it should be between 6 centimeters to 12 centimeters. I'll say my patient's case, it's 8 centimeters. Okay, and then now we're going to precurse the spleen. So it's very, very hard. It's pretty, because the spleen is just right underneath the rib cage, enclosing the rib cage. So it's pretty difficult to feel the spleen. So, and then in case of where you have a splenomegaly, an enlargement of the spleen, extends all the way down to the right lower quadrant. So if palpating or precursing, we have to begin from the left lower quadrant, just to be able to find the spleen. Okay, so I'm going to precurse all the way from the left quarter quadrant from the right lower quadrant to the right hypochondriac area. Okay, this involves me tapping, just tapping tympani to dullness. Okay, all right. So see, around this area we have our spleen. Okay, and then I'm done precursing. So now I'm just gonna palpate for my spleen and also for my liver. Okay, so same thing, I'm gonna start for my liver. I'm gonna start all the way down to my ilia, from the ilia crest all the way to the anterior ilia, anterior ilia all the way up, okay, to the right upper quadrant. Okay, all right, and then I'll have patient take a deep breath, and I'm gonna go in and just to feel for the liver here. Okay, all right, so that's done, and now I can feel my liver. And so now I'm gonna palpate for my spleen. All right, starting down from the iliac area all the way down up to the left hypochondria. In this case, I'm gonna ask my patient to take deep breath in and out while I move my hands. Okay, so I can feel in and out, in and out, in and out. In some cases, to feel it better, I have to put my patient and put my hand just under the rib cage at the ventral area, and then just push my hand in just to feel for any masses, any for enlargement or anything. Okay, all right, so that's good. So we're done with the palpation. Okay, and the way to feel for my kidneys. So the kidneys are usually located, at the posterior area of the back. Okay, so usually like the flank area of the back, like posterior and inferior. So I'm just gonna have my patient lie on the side, and I'm just gonna palpate this way with my both hands, just to feel. Have the patient take deep breath in to enable me palpate. Okay, so I can feel for my patient's kidneys on the left side, and then we can do the same for the right. Okay. Just put my hand to the back, in front, and then try to palpate as I ask my patient to take deep breath in and hold while I try to feel for the kidneys for any swelling masses or any form of discomfort. Okay? Alright, so that's done. And then lastly, we're going to check for coastal ventral, the coastal vertebral angle on my patient. So this is just usually located below the 12th rib at the back. So I'm just gonna feel for it. Okay, check for any form of discomfort or tenderness. And I'm also just gonna put my hand and I'm just gonna slap on it. So this, this method of precaution kind of causes some kind of like discomfort in the patient. So if there's any pain in the process of doing that, the patient actually has the CVA tenderness. I'm going to do it on the both sides as well with my hand and just a mild thumb. Okay, and ask the patient if the patient feels any pain or discomfort in the area that were, that were slapped a little bit hard. And there we can check and see if the patient had any form of CVA tenderness. And this comes to the end of my abdominal assessment. Thank you.